Okay, number one, can you repeat how to know when to do breast compression, i.e. you said something about waiting for the baby to start sucking again and then compress. How long do you hold the compressions, Dr. Newman?
Well, if everything is going well, you don't have to do compressions at all. This is just a trick to get more milk into the baby. So, in the vast majority of cases, if everything's going well, the mother really doesn't have to do any breast compressions. What we will note is that, if the mother feels she needs to do it, then she compresses the breast, and as long as it's working, in other words, is the baby getting milk, then she maintains that pressure, and then when the baby is not drinking anymore, she releases the pressure, and she waits for the baby to start sucking again, and then compresses again. But I do want to emphasize that this is not necessarily something every mother needs to do. We teach it so that the mothers in the first few days, when they are at greatest risk of being told by the health staff that the baby needs to be supplemented, that this is something they might use then, but if everything then goes well, then we don't have to do anything at all.
And did either one of you want to add anything? Okay, great. Thank you, Michelle. What do you recommend when a mom has too much milk, aka too forceful of a letdown reflex?
Yeah, you got it.
Well, okay, I'll say that I really don't believe in the whole notion of too much milk or overactive letdown reflex. If the baby can't handle the flow, and that's the usual reason mothers are saying, I've got too much milk or I've got too much of a letdown reflex, the problem is not really the amount of milk or the force of the letdown. The real problem is that the baby's latch is not as good as it should be. A baby should be able to handle really good, even abundant flow. And so there's usually something that isn't quite right there. Now, it may not make that much difference. The baby may be thought to be colicky, and sometimes this settles down on its own. But really the issue is, why is this baby not able to handle the flow? And it's because the latch is not as good as it could be. So a lot of the babies we see where the mother seems to have an overabundant supply, it's just a question of how the baby's positioned. And if that baby is positioned somewhat differently, a little bit more like what I was trying to show, then the overactive letdown reflex tends to disappear. And some of these babies have tongue ties. The real problem with tongue ties is not the ones that are so obvious as the one I showed in the videos there, but the ones that are more subtle. Because healthcare professionals, particularly physicians and pediatricians, have never been taught about breastfeeding, and they don't know about tongue ties, which can be more subtle. Those are the main reasons. And so technique, I guess you can call it. We don't like to talk about technique, about something that's supposed to be natural, but in the atmosphere of these days where even breastfeeding is no longer considered to be natural and normal, then we need to look at technique, we need to look at the baby's tongue tie, and sometimes the fussiness and the colickiness that we see in babies whose mothers feel they have an oversupply is actually a situation where the baby is reacting to slower flow. And again, when the mothers are not taught about how to know the baby's getting milk, they will often attribute this fussiness and difficulty at the breast to too much milk, too much force. And so in any case, we say finish one side, offer the other. And the one problem that arises out of this too much milk is you have to feed the baby on just one breast at a feeding, and even worse, something called block feeding, where mothers are told, feed the baby on one breast 4 or 5 times in a row, sometimes even more, and then only after the baby is fed 3 or 4 or 5 times on one breast, then the next feeding you start on the other breast, and they do the same thing on the other. And that leads inevitably to a decrease in the milk supply, and many of the symptoms in the baby that would be mistaken as oversupply.
It's a similar question, but it's been handled.
Okay, and Natalie, can you follow up on when did your daughter start to get colicky and have an oversupply issue?
So for us, there were a couple different markers in our family, and again, I think to build off of Dr. Newman, so much of the kind of the correction that happened for us was her latch, and it seemed like as she grew, her and I kept having to work on her latch. Now, whether there was something else going on, I'm not sure, but we'd kind of at 6 weeks was a major point for us, like 6, 7 weeks. And then again, around 3 months, there seemed to be a kind of a trickiness for us. And then after that, things seemed to moderate in our family. But those were the 2 times that we sought assistance at the breastfeeding center in Vancouver, and also support from our doula. And even though we'd been discharged from our midwife, she very generously had us over for a visit at her office and continued to work on our latch.
Great. Okay, Sandra, you mentioned with our mental health and substance use services, how does one self-refer? And what is normal postpartum, and how does it work? Who do you call if you think you need some help and you want to self-refer?
That's a good question. So self-referrals for mental health and addiction, you can just call them and you can ask to make an appointment with a counselor.
Okay.
So that's your self-referral. Sometimes there's a wait because our services are, there's a long wait list sometimes, but they try to see people urgently depending on the needs. When it comes to when to seek support, usually when you're noticing a change in your mood for more than 2 weeks. When we talk with women prenatally and postnatally, we're usually saying if you notice something that's not feeling your usual self for more than 2 weeks, or you feel, or maybe there's something that is really concerning within your mood and it's within that 2-week period, then you can touch base with your public health nurse, you can talk to your doctor, your midwife. There is the Pacific Postpartum Society that Natalie had mentioned as well that's available. You can find their number online, you can just Google their number, and you can contact any of those resources and they can connect you with support. And yeah.
Terrific.
Yeah.
Anybody else want to say anything about postpartum? Okay. Okay.
Just really quickly, we had somebody in our family move through significant postpartum depression and anxiety, and there's a great resource on the Pacific Postpartum Society website around things for families and partners and friends, how you can help and how you can be of support to that person. So maybe you're not going through it yourself, but you know someone who is. That was really helpful for us.
Terrific. Thank you. Okay. We have one that refers to, my child is 2 months old and has a problem getting a full feed. Around 5 minutes in, he decides he would rather lick and smile at my boob and then eat and then gets fussy. How do I fix this behavior? I don't want to force him.
Well, you can't force him. He's not going to take the breast if he doesn't want it. But I think it's not mentioned if this is something new or something that's been going on all the time. I mean, babies are fussy 99% of the time. I hate to say 100%, but 99% of the time because they want more milk. So what can we do to help a baby get more milk from the breast? And the answer is, first of all, get the better latch. And that includes looking for that tongue tie. Again, you know, there are a lot of physicians that will reject the notion that the tongue tie is even a problem. Never mind that know how to diagnose the tongue tie, but I think that that's one of the issues. And although mothers who have babies who have tongue ties often cause the mothers to get sore nipples, this is not always the case. In fact, it's not always the case that the baby doesn't get enough milk. But the thing is that we need to get that latch to be just so. We need to let the mother know how to know the baby's getting milk, because if the baby's getting milk and remains hungry, then he will stay on the breast and won't come off the breast. So often when a baby lets go of the breast and looks at the mother like that, you saw the videos I showed, the baby is often not getting very much milk from the breast. And so that's where before the baby starts coming off the breast, this is another place where breast compression would come in to keep the baby drinking at the breast. And then when the baby is no longer drinking, over to the other side. Sometimes we need more than just that. That's often enough. But mothers will use various herbs and stuff to increase the flow of milk, and we don't know how well these work. I've always talked about fenugreek and blessed thistle. Do they work? Maybe they work. We don't know. We don't have good evidence that they work. They seem to work in some mothers. They seem to work less well in other mothers. The new hot thing to increase the milk flow is now moringa. Moringa is hot stuff, and whether it works or not, we don't know. If we see the mother, or if I'm speaking to a mother by email, and there seems to be a real problem, I will recommend domperidone, which I think is a very good drug and a very safe drug, no matter what Health Canada says. And it can be used in such occasions as well. But again, it's not the first thing to try. The first thing is to work on the latch, use breast compression, switch sides, and that will often do the trick. After that, sometimes domperidone, sometimes the mother needs to supplement. It depends. And we recommend the lactation aid at the breast. We recommend lactation aid at the breast because it keeps the baby on the breast. And it's a philosophical issue with our clinic and with me that breastfeeding is much more than just the milk. Even if you have to supplement, if you're supplementing at the breast, you're still breastfeeding. And breastfeeding is much more than breast milk. Breastfeeding is a close, intimate, physical, and emotional relationship between two people. And we don't want to give that up, because when the mother is told, you've got to supplement your baby, then give them bottles, often that baby will start to refuse the breast. And we know that's true. And it's really a shame when there are other ways of dealing with the problem.
What is the best treatment for thrush for both baby and mother?
Well, the thing is about thrush, and I have to say that I'm somewhat guilty in all this, is that the real issue is not thrush. If presume the mother has pain. Is that what we'll presume that the mother has pain, and that's why she thinks she has thrush, or somebody's told her that the baby has thrush. Because if neither the mother has pain and the baby is not bothered, and babies are rarely bothered by thrush. I mean, you see a baby with a whole mouthful of white, and they're just sitting there, goo goo gaga, I'm all happy about this. They don't care. And if the mother doesn't have pain, if the baby's not bothered, then there's no need for treatment at all. But the usual reason that mothers are bothered, are worried about thrush, is because they have sore nipples. And one thing that you need to know is that candida, which causes thrush, this fungus that causes thrush, it doesn't grow on normal skin. So that if a mother has pain in her nipples and thinks it's thrush, and it may be, then the real problem is an underlying problem. And that underlying problem is the damage to the nipple that's been caused by, almost always, a poor latch. So too many mothers, too many physicians, too many lactation consultants are all, they've got these huge protocols to treat thrush, but they're missing the underlying problem, which is the baby's latch and the damage to the nipples. So the first thing is to fix the problem, which is the underlying problem, the pain due to the latch, usually. Now, I won't say always it's the latch, because I think I mentioned that you can get eczema of the nipple, and that'll cause pain. You can get psoriasis, and there's some other skin problems that can cause pain. But the real 99% of the time, it's the latch. So let's fix the latch, and you may not even have to treat the thrush. But if you need to treat the thrush, we've invented something called the all-purpose nipple ointment, and it contains something for candida, and it works very well 99% of the time. Nystatin, which many doctors still seem to like, is pretty useless. The babies hate it because it tastes awful, and it doesn't really treat it. I mean, even several years ago, I read an article where they looked at the sensitivity of the fungus to nystatin, and only 28% of the funguses were sensitive to nystatin. So it's probably even less than that now.
Okay, thank you. Here's a question about drinking while breastfeeding. Is it unsafe? And if not, then what would be safe?
Well, if, we think that the baby's always drinking when he's on the breast, no? Oh, you mean the mother. Okay,
The mother.
sorry.
Alcohol. Self-medicating.
Well, look, this is a huge issue for some people, and I don't think it's such a big issue. I think that you have to remember that alcohol acts in the mother's breast like water. It goes back and forth from blood into the breast and back into the mother's blood. So I don't know what the upper limit here in British Columbia is. In Ontario, you're considered too drunk to drive if you have 0.05% alcohol in your blood, right? So is it the same here? 0.05? Don't look at me. Yeah? Okay. So if the mother has 0.05% in her blood, her milk will contain 0.05% alcohol. Now, you could drink 0.05% alcohol all day and all night, and you still wouldn't have an effect from it, right? I mean, 0.05%. I mean, alcohol in whiskey is 40%. In wine, 12, 13%, right? So it's really a minimal amount. I think that if the mother is, wants to have a glass or two of wine at dinner or even any time just like that, then it's okay. I think that we have to remember that society has changed, but the primary caretaker of the baby is still the mother. And so, if she's had enough that she cannot respond adequately to the needs of her baby, then that's the problem, not the glass or two of wine that she might have had with dinner. That's not the problem. And so, and that's the same for almost anything else. Now that cannabis is everywhere, if the amount of THC that gets into the milk is minimal. I mean, it's tiny. Okay, but if the mother is unable to respond to the needs of her baby, if something happens to the baby's not quite right, you can just see, if you know about cannabis, that you can get into this paranoid state. The baby may be fine, but the baby's acting a little bit different than usual, and then all of a sudden it gets worse and worse and worse. Whatever it is, the alcohol, the other drugs, you have to be aware as a mother of your baby's needs. And what do you do if you start to get this paranoid reaction with cannabis, and you're worried that your baby is really, really sick? You jump in the car and drive to the hospital? What do you do exactly? No, just stay cool, don't get too high, don't get too drunk, take care of your baby, and the alcohol and everything else is okay.
Terrific. Natalie, can you share how did you or do you moderate your diet and or drinking as you're raising your child?
So diet and drinking, both? Well, the great thing about breastfeeding, especially in the early days, was she was taking so many calories. I was just like all the snacks all the time. So there wasn't much moderation going on in terms of that. I think that what has been an interesting process for me through all of it is you and you're also a mom, and those two identities are coming together, and sometimes they collide and sometimes they mesh really nicely, but it's carving out that new space, this new identity. And so do I eat kale at every meal because I'm breastfeeding my baby. No, I don't. Especially in the early days, there were meals of dinner that consisted of popcorn because it's like it's all I could get myself together to do. But I think that you do the best you can in that moment for you and your kiddo, and you need to be well to be able to take good care of your babe. So some days I think that that box of macaroni and cheese fed my soul in a way that kale wasn't going to, and so that's what I went for, even though it didn't have the highest nutrition count. But you make up for it some other day. In terms of drinking, I think to echo what Dr. Newman is saying, it made me the idea of not being in a state where I could take care of my daughter or let's say drive to the hospital if she needed us to, or do any of those things, made me really nervous to the point that I didn't want to take that kind of risk. So I do personally, this is all personal choices personally, I would have maybe a glass of wine with dinner, and now that she feeds less, those things shift too. But for me, it was really important to always be in a state of mind that I felt like I could respond to whatever she might need, even in a worst case scenario.
Great. Okay, last question. What is a fact or scientific piece of knowledge that, even after all of your time and experience researching breastfeeding, still continues to amaze you?
Well, actually, there's tons of that. But I think that, when you read about the ingredients that are present in breast milk, in particular, the immune factors that are being piled on as we learn more and more becomes available. And there's so much. I mean, the immunity of breast milk has gone, and I will admit it, quite openly, I will admit that it's gone way beyond what I can understand anymore. I don't understand all the reactions, all the interactions, and I think that the notion of breast milk as a living, changing fluid is really something that continues to amaze me, absolutely. It's something that can never and never will be copied. It's just impossible, because even if you could add all the ingredients that we know about, the fact that breast milk changes with the needs of the child, with the needs of the mother, and over time as well, means that it'll never be duplicated.
Terrific. Thank you very much. And thank you, panel, for doing a great job tonight.